So snoring is a very common problem which we encounter in our patients. This snoring can be seen both in children as well as in adults. So we have to evaluate the patient properly, because the evaluation pattern is a little different in children as well, and the evaluation pattern is different in adults. It means usually because there is a sagging of the tissues in the oropharyngeal airway, which causes breathing difficulty and disturbance of sleep, and the child doesn't get up fresh. Why is it important? It is very important because it has got implications on everybody's health. So even may it be children or adults, a long-term snorer has more tendency to develop heart disease as well as stroke and many other systemic complications. So it is very important to detect it in an early stage and treat it as well by an ENT surgeon. Okay, so we will go through what is the basic cause. So there are multiple causes in children and adults. In children, if you see the causes, there can be blockage. It starts with any blockage in the nose, in the nasopharyngeal region, in the oropharyngeal region, or it can be because of a short jaw in most of the patients, that can be associated with some sort of syndromes, and it can be because of a prominent maxilla, and it can be because of a huge bulky tongue. So these are the most important local causes which we have to evaluate. And the other things, whereas in adults, similar thing, we evaluate the nose of the patient because there can be some sort of foreign body, there can be hypertrophy of the nasal turbinates, and then we have to evaluate the nasopharynx of the patient, and there other multiple causes can be seen. And in the oropharyngeal region, we have to evaluate the oropharyngeal region, the tonsils, the vallicular region, and this epiglottic region and the supraglottis. All those things we have to evaluate in an adult patient. So these are the causes from where the snoring can occur, because of the laxity and sagging of the tissues. And the most important systemic cause in adults and children nowadays is obesity. And how do we prevent this snoring? What are the basic preventive measures? What we have to take, what we have to explain to the patient in children and adults. That is, for example, in children, we can tell they have to reduce the weight, as obesity is a major factor, and other things, they have to avoid eating junk food, and we have to promote eating healthy foods to the children. And in adults, they have to avoid smoking, reduce the level of the stress, avoid alcohol, and they have to maintain a very good healthy lifestyle. So what is the management of snoring? There is a medical management as well as surgical management. Medical management is done in early stages. Early stages, we have to counsel the patients, even if it is a child or an adult, we counsel the patient. Then we go for, we advise them to have a better lifestyle, we advise them to reduce the weight. In case all these measures doesn't reduce, we have got a very good test that is called a sleep study, that is polysomnography, right now, which we are doing it in Badalsama Sohar. Okay, so after evaluating the patient of other parameters by doing a polysomnography, we advise the patient for a continuous positive air pressure machine, that is a CPAP machine. Okay, whereas the surgical management, there are many managements in which I want to highlight the most important thing. In children, one of the most important causes is adenoid tissue, that we are doing it with a microdebrider, which is the latest management technique in adenoid removal. And in adults, we have got many multiple treatment options, like we go for a UP3 and other things. So the basic take home message is that, so the snoring should not be neglected, whether it is in children or adults, and you have to see an ENT surgeon as early as possible. Okay, thank you.